And take it away. Tell us who you are, why you're here, and all that good
Okay,
stuff.
let me pull this up. There we go. Yeah, my name is David Konn. I don't know, can you see me on the screen? I am not sure this is set up right.
We see you fine.
Okay, so yeah, my name is David Konn. I'm the founder and president of Quantum Cellular Medicine Clinics. We work with clinics around the country bringing advancements in this field we call quantum cellular medicine, which is a new field in regenerative medicine or part of regenerative medicine. And we try to bring the best technology globally for our clinics throughout the country, which includes, we're going to be talking about pulse electromagnetic field therapy, the first resonance-based technology that was developed in Germany, and also exosome stem cells. Some of the doctors here know me from that, and also an enzyme fermented ginseng, which I'm a patent holder on, and that was my original entrance in this world of regenerative medicine, and try to help our doctors do really well. So we'll just get started. So the question is, what role does PEMF play in healing? And let's just take a look for a moment at regenerative medicine, which is all the functional medicine docs are in this field, this evolving field, which we cover every week with new technologies. The key and the beautiful thing of this organization is you share best practices, best technologies with one thing in mind: to heal the patient, to help patients achieve their optimal life. So I think the beautiful thing of this organization is all the doctors have that passion, and that's what they do. So I just want to take a moment. So regenerative medicine, I always remind all of our clinics the same thing. So is regenerative medicine a spectator sport, or is it a participation sport? And of course, you all know this. It is a participation sport. So this is not something that they come say, "Doctor, fix me." The doctor becomes a consultant, bringing the best in the global technology to help the patient commit themselves to wellness and health. So we call quantum cellular medicine, it's a segment of medicine that focuses on cell function and cell communication, the diagnosis, treatment, and maintenance of health and wellness in the human body. So we focus on cell regeneration. And the theory of this, the company who developed this resonance-based PMF is healthy cells, healthy body. So everything all their focus and research is on how do you transform the way the cell functions. And their scientists and researchers examine the process in the cell intensely more than 3 decades, far more now. And I like to say quantum physics has given rise to quantum biology and quantum chemistry. So what used to be in that world of energy you can always see, you heard stories of even clinical studies on people praying for patients in a hospital, and they found clinically significant results. But now with science, we have the quantum level of biology and chemistry. So we're moving rapidly forward into the future. So why is it critical for regenerative medicine? Because it's an advanced field of medicine that supports and facilitates the body's remarkable capacity for cell regeneration. And that's where PMF comes in. There's a physical, emotional, and energetic components for achieving successful regenerative medicine therapy. And for decades, there's been a growing interest to address the problem of premature aging. Premature aging is involved in every injury and most diseases. Cell regeneration creates premature aging. You know, if you have a patient who's young, how quickly they can regenerate. But when they're older, it's a lot tougher. It's a lot tougher challenge. So there's many, many challenges we deal with. You've got, in disease, you've got genetic, abnormal, and air pollution, and you've got everything in the living, and the immunity and inflammation. So you guys are dealing with this all the time. So this is the challenges doctors face. You've got autoimmune, which is the body's confusion. The immune system is energized to take out its own function, and it gets confused. And that's why traditional medicine doesn't work, because if you're chasing a symptom, you're going to create a more and more confused body. And I know this is something that everyone in this call is very aware of, and you do great work. So everything from your thyroid, bones, muscle, skin, it's all affected. So types of healing, I like to always say mind and body connection. That's the key. Your mindset can affect you on a physical and chemical level. In all of our clinics in QCM network, we always stress this mind side. And again, the patient has to know that this is a participation sport. If you're not ready to participate, whatever we try to do is going to be very limited. Lifestyle choices, the foods we eat and exercise, and of course, regenerative medicine, everything we introduce in the area of technology and science and supplementation that the recent levels of science can help us with. So it's always about cell function and dysfunction. Cells under constant stress from pollutants, diets, too much or too little exercise, drugs, and other lifestyle choices. When our cells are weakened, we look and feel exhausted, and we're more prone to disease. This is why we need to look at health from the cellular level. This is the core issue of what pulse electromagnetic field therapy is doing. So again, regenerative medicine, participation sport. So aging in human and other species is evolutionary conserved mechanism. What does it mean? Well, there's a built-in mechanism to make individuals expire. And that's what we call aging. So most of the ailments physicians are related to inflammation, degeneration as we age. So this is something we're all dealing with. If we can solve the problem of aging, we begin to solve the problem of disease. So I'm going to move on ahead. So basically, QCM brings technology and expertise to address these. So regenerative therapy is an ongoing process.
Dave,
I'm sorry?
don't mean to interrupt. Do you have slides? Because we don't see them.
Oh my gosh. I've been running.
Yeah.
I've been doing the slides.
Yeah, we don't see them.
Sorry. Okay.
Share the
let
screen
me
there.
do this. Okay, I
I see.
didn't share the screen.
So some things never change, right?
Oh my goodness. Here we go. Okay. Yes. Okay. Yeah, I had a slide problem because Dr. Beta, who started me off in this whole
Mhm.
thing, he had a problem with his computer, and so I had to recreate everything. Anyway, let me just
Go from the
flash
current
this.
slide.
Yeah,
Go
I'll
from
go
the
from
current slide right here. There you go.
Sounds good. Well, it's
There you go.
there we go. Sorry about that, everyone. My great apologies.
Thank you for clicking also for the recording. That's awesome.
That's good. So as I said, mind-body connection, lifestyle choices, foods we eat and exercise, regenerative medicine, restore and rebuild the body. It's what we need to do. Cell function, dysfunction, this is the challenge we're always in. Cells are under constant stress from pollutants, diets, too much, too little exercise, drugs, other lifestyle choices. When our cells are weakened, we look and feel exhausted, and we're more prone to disease. That's why we need to look at health from the cellular level. Again, regenerative medicine, spectator participation sport, of course, it's a participation sport. Aging, that's the issue. There's a built-in mechanism for individuals to expire. That's what we're working with. People want longer and healthier lives, not just longer lives, promoted by just a drug or just a symptom stopper. We're looking to see the whole body regeneration. And so we're really addressing premature aging. So the key component for successful regenerative therapy begins at the cellular and subcellular levels. So QCM brings technology and expertise to adjust this. And regenerative therapy is an ongoing process. It's a full patient participation. QCM clinics provides their patients with critically needed home therapies. One of the key things is you want something in the clinic, but you want something at home that they can continue this process of daily regeneration. And that's what we focus on, and that's what the PMF is about. Stem cells, which is the body's own way to regenerate. Mesenchymal stem cells, newborn, 1 in 10,000. As you age, it dramatically changes, tremendous loss of regenerative capacity. by teenage years, there's 90% decrease. And 50-year-old bone marrow cells provide only 2.5 MSCs for regeneration. So this is what we're dealing with a whole range of issues. So this is just a good schematic on the body is a magnetic energy device. And I know this is what you all know, but basically each cell has a positive and negative field in the DNA. And this is what PMF is dealing with. Cell division is a process responsible for keeping the body healthy and rejuvenated. The force which activates the formation and division of cells is magnetic energy. The proper function and interaction of all the organs and systems in the body depend on constant presence of adequate magnetic energy. So magnetism is essential for the body's electromagnetic activity. I'm sorry?
Never got over.
I know who you're talking about.
Okay, so magnetism is essential for body's electromagnetic activity and plays a major role in health. So basically our body's electromagnetic system. So how does PMF work? What is it? How does it work? Well, basically the PMF represents pulse electromagnetic field. The best way to understand it is the earth is a magnet, our bodies are magnet, and every one of our 70 trillion cells are magnets. So you've got this IO area, the in and out of the cell that you have to resolve. People talk about going to the ocean, walking on the beach, grounding. So the many benefits of pulse electromagnetic field therapy is trying to restore that magnetic field, that magnetic resonance in the body. People don't realize it, but there's more than 2,000 university-level double-blind medical studies done in many countries with many different PMF therapy devices. A lot of times doctors don't realize there's so much science and research on this. Some of the positive effects of PMF therapy were already established by the mid-1900s. And the first commercially produced low-power devices were actually early in the 1900s, 1920s, 1930s. So there's basically two areas of PMF. One is your low-power PMF systems, and the other is the high-powered. So the low-powered, they're first commercially produced, and again, in the early 1900s, they're used for studies and experimentation in healing and cellular wellness. The high-powered PMF systems, that means high Gauss. The resonance of the earth is only 0.4 to 0.5 microgauss. So, I mean, sorry, 40 to 50 microgauss is 0.4, which is 0.4 to 0.5 Gauss. But the high power system are multiples in Gauss, 10, 20, 30. Now, the high powered systems began actually in 1975, and they focus on muscle, nerve, tendon, ligament, cartilage health, and reducing pain. The high Gauss systems are ideal for in-clinic care because they're dangerous. However, if with proper education and the doctor knows how to manage it, he can actually create a good therapy in the office, but you cannot take them home. If you do, a lot of chance for the patients to make mistakes and have problems. Medical PMF therapies have been accepted in many countries around the world. The US FDA, which is not always favorable to alternative therapy, but they accepted the use of PMF devices in 1979 for the healing of non-union bone fractures. In 98, for urinary incontinence and muscle stimulation. In 2006, for depression and anxiety. So already the FDA has accepted this technology in these areas. Israel accepted use for migraine headaches. Canada accepted it for several uses, in the European Union has many acceptances for PMF, and that's really where the technology that we're dealing with, was resonance-based PMF, was developed in Germany. So in 1975, resonance-based PMS was invented. It was Dr. Linus Pauling, Dr. Robert O. Becker, and Dr. E.G. Fischer. Dr. E.G. Fischer is the physicist from Germany, the founder of the company, who brought in Dr. Pauling and Dr. Becker to help him in developing this technology. As happens often in this field, someone has a health problem and they pursue a solution. Dr. Fischer was a multimillionaire in the area of physics, and he had a tremendous success he actually developed great advances in pneumatics. If you remember years ago, those Japanese cars those doors would just close with a, and our doors were closing clunk, because we were still using hydraulics. They were using pneumatics. So he was right in the forefront of that, became a multimillionaire, but he got a serious problem. He got a serious stroke in his mid-40s. Everything changed in his life, and this began his whole odyssey into developing the resonance-based PMF technology. So his system is called Cell Vital. It's quantum resonance-based systems. It restores cell membrane IO function. That's the in-out function of your cells. We'll talk about a little more. Absorbs something which is more and more known by patients, electrosmog, or the unstable electromagnetic field. A lot of patients are now aware of issues with 5G, issues with unstable electromagnetic smog, which damages the cells. This is the only patented technology in the world that I'm aware of that actually absorbs electrosmog, and it maximizes cell regeneration. Again, it's German technology with 5 patents and over 200 clinical studies. So that's important. I think that there are many things in the field, but if you have a clinical study, it helps you see clearly what you're dealing with. And you go through that scientific rigor where you have to pass we know that many clinical studies are funded with an objective. But we know if they're peer reviewed, it's a good way to really understand what your technology is doing. So now this is something which is central to one of their patents, which is metabolism of the cell, ion transport. What you see in a cell, and it's just a schematic. On the outside, you have a plus charge. On the inside, matching it is a minus charge. So what's happening is you eat and you digest your food. It goes into ions. So nitrogen, calcium, oxygen, and 90 other different vital substances are pulled into the cell by the negative charge in the cell. Your amino acids, your vitamins, trace elements, your unsaturated fatty acids, all the critical things we talk about, you need to have. Eventually, they end in the cell. And then in the cell, you have the Krebs cycle, which creates energy. And then you have the plus charge, which pulls CO2, H2O, and free radicals and waste products out of the cell in the milieu. That's why detox systems are so important. So cells are your basic modules of life. Improved IO function is the key for the freer way for a cell. The better vitamins, minerals, and oxygen are going to allow you. And the issue is, they had to, let's go back. In Germany, they had to get, this is one of their patents. It's one of the only technologies that proved the IO functioning in their technology, that you actually improve the IO function. And we say, well, how did they prove that? This is one of the studies they had to show. Basically, in dark screen microscopy before treatment, during a 5-minute treatment, 5 minutes after treatment, and 15 minutes after treatment. As you can see, the cell membrane reconfigures itself into that nice, round, healthy environment. So the resonance field enables that IO function to stabilize. Now, again, with injuries, this is an ongoing process, but when a cell is regenerated, it's going to tend to produce at the same level it was in, because we know that cells are reproducing every day. So basically, the issue of the cell is cell voltage. What's the energy produced by your cells? So when you're young, we talked about aging, tell about in that middle area in your 30s, maybe in the 40s, maybe in the 20s for some, depending what they dealt with, the cell energy begins to reduce. If you don't do things, it's going to continue that reduction trend. And they say down to, it's supposed to have between 70 to 110 millivolts. So in the QRS Cell Vital technology, they're studying how do you maintain that optimal cell vitality, that cell energy. And that's what they've been doing their science, and that's why they continue getting more patents. So basically, you've got overcoming electrosmog, which is critical. Again, 80%, it's an estimate, but 80% of your cell regeneration occurs in deep parasympathetic mode sleep. That's why with all of our patients, we've got to make sure they're getting deep sleep. So, but the problem is, as they sleep, what's protecting the cells? If they're in an environment, we've talked about mold in some presentations, but you've got electromagnetic fields that are bombarding the cell. Not only do they go out every day, but now the 5G is bombarding all night. So a critical element in modern life is the effect of electrosmog or dirty energy in the health of our cells. So again, as I was saying, Cell Vital is the only PMS system that has a patent proving, a German patent proving, an international German, that it does absorb electrosmog. And we've had a lot of clinical experience with it, and we can always talk about later and give you more evidence and talk with more doctors. The technology includes various devices. What happened was, as they began to get success, they went to this pen probe, which is almost like a laser. It does have a simple LED laser on it, but it doesn't require it to be skin touch because it goes through the clothing. It's a electromagnetic pulse, but for areas of pain, it's tremendous. For electroacupuncture, it's tremendous. It also works tremendously for any oral issues, dental issues. We've had people requiring potential root canal, and when they use this in orally, it actually stimulates the body's own ability to counteract bacteria, and you get the healthy regenerating cells. With the goggles, because they started getting success with glaucoma and with macular degeneration, and now we're seeing with cataracts, they developed the goggles which focus on the eye area. And with tinnitus and upper cervical areas, they made the this new device. So these devices came later. Originally was just the mat, and then there's a pillow which you put on an area of pain. So basically, our patients are looking to enjoy an optimal immune potentiated life with stable energy, physically and mentally and spiritually. And we don't want them to lose their energy. We want them to maintain vibrant life. So if they're sleeping every night on this technology, they're protected in a like a cocoon. So whatever therapies we're using, the way this really developed is I was involved in this technology with Dr. Fisher, and then I began to introduce it to stem cell and exosome clinics, and they started getting a huge increase in the results with their patients. And they said, this is phenomenal, what's happening now. So they told me, get more involved with the exosomes, and then I got really active with exosomes. So a couple things, and I don't have time to go into all the details, but one is what they call the calcium cascade. This is a simple diagram, and a lot of my more advanced slides I wasn't able to get from Dr. Bader, but we can always cover it with you later if you need. So basically, the positive ions from the blood cells are pushed against the vascular wall, where they create an acidic environment that urges calcium ions from the vascular wall into the cellular fluid. So what happens is we got the problem of calcium building up in the arteries and other areas through time. So even you take calcium, but the problem is to build up in calcium. What they find with this technology, it creates a calcium cascade. So it removes the calcium in the body, and it's a decalcification of the blood. A lot of clinical studies, a lot of direct experience in a lot of clinics with improvement in cardiovascular health. And then this is from Germany. I can't show you that, but basically there's because it was used as a hospital in a box in Germany, they have all these technologies which show actually the various conditions, and these are available when you're looking into it, and gives you protocols for every condition related to they actually track about 180 different medical conditions. I don't want to talk about that a lot on the call. We're not making claims, if FDA are watching this, that we treat or diagnose or cure any disease. But in Germany, they found a great benefit as doctors were treating patients in helping them overcome disease states, a broad range of disease. And this comes from Germany's German science and studies. So I just want to mention now, so patients want to regain their life now, but it takes time and investment. This is always the challenge that we're facing. So we want to make sure our patients are educated and activated. So a lot of this science, a lot of the videos are available on the QCM site where the patients can just go and learn. Because the doctor and their staff have a certain limited staff to give all the education to the patients. But what we need is patients to be educated with accurate information, just not the latest thing they found on the internet, which then you have to argue with them. And that's been one of the challenges in regenerative medicine and functional medicine. So we want patients to regain their life now. But we got to remember it takes time and investment.
Oh man,
I know you all know this.
you want some? And I got so much
Do
food.
they know that I'm with you?
Yeah.
Oh, Cody does, because he's there.
Okay, so the bigger reason, as the last point I want to just mention, is that we always want to ask our patients, for what reason do they want to regain their health? Because energetically, mentally, to become healthy and successful, they have to have a reason. Whatever their situation is, it could be grandkids, it could be helping society, it could be taking care of their wife, it could be just enjoying the final years of their life. They've got to have that bigger reason. If you're not in serving others, we see it always through our clinics throughout the country, and some of the clinics are on this call. If people don't have the reason, they don't have that discipline to do what they need to do to transform that health, to transform, to let those stem cells and exomes work, to let their body recover. They got to have that reason. So this technology is extremely beneficial because when they sleep on it every night, they're protected from electrosmog. So everything we're doing, all the nutrients, all the therapies, is going to be supported because in that key area of sleep, they're now going to get deep sleep and they're going to get protected so those cell regenerations can occur. So that being said, sorry, I had to rush through this, and I have a lot more science, and we can send you a lot of studies. I didn't want to take you through all the clinical studies, but I want to give you a quick overview and make some room for question and answer. I know this is short, but everyone's time is valuable. So maybe we can open up for questions.
Definitely would love to bring you back.
Yeah, what I can come back with a lot more of the core science from Germany. A lot of it's available on quantum cellular medicine or qcmedicine.com. We have a lot of studies there listed, and a lot of the videos are there.
Okay,
See, Dr.
Thomas Lewis just did a video with Bob Connolly of Sequex. They're starting to
Okay.
use this stuff. They've been using it a lot in Texas. And with everything that's going on medically, I think we're going to need people like you, like we've never needed before. I'll just be honest.
Yeah, actually in Italy, they ran a complete study on this technology alone, the Cell Vital. Huge improvements on both recovery from, at that time, CV. I'll just say CV for the call. And also treatments for CV that cause, so-called long haul. Great benefits. And it's a clinical study from a university there in Italy. And that study is available, and we can send it out to everyone.
Yeah, I could start reading through the chats. We've got some questions for sure. Do you know the classification of the on-damned? Where is
On-demand?
where is a device we would know if it's high or low powered?
Well, on-demand is a high-powered system. The challenge with on-demand has many good things, and they ran into some problems with FDA, and so I don't know their current status, but they did have some challenges. But the one challenge with any of the high Gauss systems, they can't take it home. So what happens every night? They can come into that treatment once, twice, 3 times a week, and it's going to help them. But what is that's doing every night in the regeneration? So they don't have that beneficial side of it. But there are a lot of high Gauss systems which can be very effective in the clinic. On-demand is one of them. I'm not sure what on-demand is doing at the moment, but they are a higher Gauss system. Resonance-based technology didn't really exist. They had low Gauss systems. And then with Dr. Fisher, he developed this resonance-based system and his patent, so no one could really duplicate it. So he's the only one with this, 5 patents, which differentiates it. And I would say today, the most powerful component is that it's like sleeping in a cocoon. It protects you from electrosmog. And we even have seen, we don't have studies on this, but we've seen it pulls the electrosmog out of the body. And we've had some clinical experiences. I can share that with you later if you like.
Do you know about OsteoStrong and their PEMF mat and their air cuff stuff and their bio?
Yeah,
Okay.
they use our technology.
Wow, kind of
They
figured.
use our technology. They study the market. It's a great technology, osteo, and they use ours. That's what they use.
I went there for 2 months and I didn't do any of the armbands or nothing. And I swear my muscles grew. It was,
Oh yeah.
yeah.
Yeah, it's exciting. I got to get back with Kyle because they've been using the older version where they're going to upgrade to the newer version.
Right.
And it has a special, it's a Fibonacci. They study the Fibonacci sacred, just say sacred numbers, and they incorporate that into a new signal in their system. That's just one of their newest patents.
I think it's going to be so huge for all the vaccine injury. We all know that's happening. It's going to be absolutely mind-blowingly needed. Sonoma is a German system. Is it high-powered, I think?
I'm not familiar with Sonoma. I could look it up if you send me their site. It's very simple. When you look at the Gauss, and they talk about number of Gauss, 10 Gauss, 15 Gauss, 5 Gauss, 30 Gauss. There's all different ranges. That's high Gauss. Resonance space is micro Gauss. This is why this technology is so safe. They take it home. Can they get injured? Almost not, because the highest setting of this technology is 40 micro Gauss or 0.4 Gauss. Every technology says everything, whether it's a heart monitor, if you're less than 1 Gauss, you're safe. And the mat itself is only 0.3. It's the pillow that goes to 0.4. The pen that I showed you is only 0.15, but it's very focused in a certain area. So, but it's all works on micro Gauss. That when they developed this, they really studied this resonance based of all the organs. They found all the different organs have a different resonance. So they made a field that maps all the resonance, the resonance of all the different organs. So that's why it balanced out. That's why it became known as the hospital box in Germany. And then there were knockoffs that came out, which it's okay, but they could not duplicate the patents, which they haven't.
So you're mostly using low frequency, if I got this right?
All low frequency. The highest setting we have at the maximum setting is 0.4 Gauss. So if you're at the maximum, which is vital intensive on our device, and you're on the mat, it's only 0.3 Gauss at the maximum.
What's a Gauss?
Oh, Gauss is a magnetic measurement.
Right.
You can also extrapolate that into electromagnetic, but I usually use the magnetic. So it's a magnetic field. So the Earth, the resonance, the Schumann resonance of the Earth is between generally 30 to 50 microgauss. So you're within the resonance of the Earth's magnetic field, which we have problems with because of buildings and cement and all these. That's why a lot of practitioners talk about girthing and getting bare feet in the sand or going to the ocean. It was interesting when I met with the German engineers, was trying to understand this technology. They said that when it's like walking on the beach for about 3 hours, where you get the ions from the ocean, you get the energized sand from that, and it really stimulates the body, and the whole body kind of becomes connected to the earth, and everything starts to function well. He just used that example. He didn't give me any clinical studies on it, but he wanted to give me an idea of what this is doing to the body.
So it's like your low dose frequencies are allowing and or teaching our bodies how to handle the high dose 5G, 4G type frequencies, possibly.
Yeah. Again, if the Earth is 30 to 50 microgauss, and this technology is in that range, then it's kind of in a way mimicking the Earth's ability to bring you into balance. If we were all living on natural ground without pesticides and all the garbage and the nightmares and the now electronically, we weren't living there. You know, we don't know. It talks, and I don't know, it's not a religious thing, but the Bible talks about living 800 years. We don't know about that, but like for instance, life extension, if you know them or you know the radical age extension folks, they use our technology. They're passionate about living way beyond 120, 150, 200. That's their goal. And so we're actually doing a clinical study with them now, combining exosomes, and Dr. Burgess would like to hear that with the fermented ginseng and the PMF.
Doc and I both take it. Dr. Dale, if you want to mention or talk about what Sonoma is, that would be appreciative.
Yeah, it's a standard mat and pad. We've had remarkable results with it. Actually, I actually put my dog on it because he's a old rescue. We don't even know how old he is, but he's pretty old, and he was getting very badly arthritic. My son actually took pictures of him, a movie of him coming down the steps. You know, the 2 feet forward, the two, and then the next 2 feet. And then after his treatment, he came down the steps not only normally but very rapidly. His arthritis, the effect lasts about a week. We treat him once a week, and we treat him for 15 minutes. My
Okay.
husband had a hip replacement. He was having considerable pain in the area and in his leg. After one treatment, the pain was gone. I have a artery in my leg, which was blocked by scar tissue from an old injury of the leg. I actually developed a pulse in that ankle after my first treatment, and it's continued. It may be high powered, and they did mention my son is a physician in Chicago, and I'm a retired physician from Michigan. So we're really very interested in that technology. And he did mention, though, when we talked to, James calls him the old man. He's the guy who developed it. He says that the lower, actually the lower numbers are more powerful. He did mention that. So
That's great.
yeah,
That's
so
wonderful. Thank you.
uh-huh.
All of those things you shared are the direct testimonies we're getting from our patients. So and especially pain, you know, the dogs. We have one of my Dr. Ott was it's actually on one of our videos. He says they had an old dog, and the dog was really ready to pass, and he was telling his wife, you know, it's just time, my dear. We just take him out of his misery. Well, he jumped on the mat, and remarkably, he was like barely could. He didn't jump on. They put him on the mat. He was so weak, and then he lived another couple years, and they were so happy. And so it is the one beautiful thing about animals. You don't really have much placebo effect, do you?
No, zero.
Amen. We have another question. And I also have one. Is Sonoma same as Omni PEMF? That's the one coming up when you look it up.
Oh, really? I do not know. I know that actually I could grab the instruction booklet. As long as you're, as long as you're a practitioner, they give you a lot of information about how to use it and how to, and a lot more specifics for the general public, I guess. They just do some ranges and they keep it very conservative.
Is that spelled Sonoma? Senoma?
Yeah, it's Sonoma. Sonoma.
So while you're looking that up, have you heard of brain tap yet, David?
I have heard of it. I'm not really an expert in it at all, but I
Okay.
have heard of it.
I'm working with the CEO, Michael Porter, the brother, and Dr. Porter, and it's going to be part of the things I start to do. I believe will help with suicide with veterans and responders.
Great.
It uses binaural beats, and there's other things I'm still learning, and heart rate variability. We match it together. We can put clamps on your wrist with water, and it measures your heart rate variability. And then we use the red and blue lights in the ears and the blue lights in the eyes, and that penetrates the mitochondria, and it rewires your autonomic nervous system, your parasympathetic and your sympathetic system. And they're having such great results that a 90-year-old, she got off of her walker and she got off of her oxygen.
That's
It's
great.
absolutely amazing. So this electricity type medicine, I think, is just going to be huge.
Yeah, I think so. Yeah, I'm sorry, Dr. Dell, I can't see Sonoma online. If you want to send it to me, the link.
Yeah,
I did a search and it
looked,
doesn't come up. It doesn't come up,
Yeah.
so.
and I just looked through the booklet to see if they had information on the company. It's funny, we have a phone number and all that junk, at least my son does, but I do not see a company name, just the name of the
Okay.
product. I don't know where you would actually, there must be a way, there must be a website, because I see that I have the sign in and the password. So I would, unfortunately, my son has gone home. He visits now and again, but I don't.
I can give you my number if you want to text me sometime and you can send it to
I
me and
would
I
be
can.
happy to do that. I would be happy to do that. I'll ask my
So
son after.
should I put
that
in the
so he knows
chat
the
there,
company.
Joel?
Yeah.
Yes, that'd be
yeah,
good. And I'll
definitely.
take a picture of it.
And how much is the Cell Vital? We're putting together a clinic right now here in Reno, Nevada. How much is the Cell Vital quantum process?
The Cell Vital is 4,650, and that includes the local treatment area pillow and the mat, which for many people covers everything. And we have the laser pen, which is very common. Sometimes we do promotion where that's included,
Right.
but normally if you buy it separately, it's $450. The goggles and the ear device, those are $695. And if needed for those things, so as there are options, you can always add them later. You don't need them right away.
Do you have a package deal with all of them combined?
Oh yeah, we have a package deal combined with them all, and we have a special arrangement for doctors where our passion is to work with doctors. I mean, QCM. So the doctors, basically, some doctors don't really want to spend time. They want to just send the patients to us, and we will take care of everything. And then we send them a 20% commission.
Okay.
Some doctors get very active. They want to buy and resell, and so they get 30%. And we have a special promotion where they can buy one for in-clinic use, which is even a deeper discount. And if anyone does IV therapy, huge results with IV therapy, because when they're on the mat and they're getting IV therapy, I don't know if you know of Hippocrates in West Palm Beach,
Yes.
they sell like 30 of these a month.
Right.
And they use it in their IV therapy. And when people do IV therapy on the mat, the results are just far better. And I don't have any clinical studies on it, but that's one of the main things that Hippocrates does in their clinic, is they offer it as an extra benefit. And it works out well because they're able to offer additional $100 fee. They get the IV therapy and they put them on the mat. And then that's one way that doctors like to utilize it. So it makes a lot of sense. If you're improving the IO function of the cell and you're doing IV therapy, you're going to get more, because in the end, it's what goes in the cell that really counts.
Agree. No, that's wild. Brain tap. has proven through massive studies that their brain tap increases IV infusion 30%. So if we introduce your type of stuff and brain tap, we're talking, 50, 60% increase in IV infusions. That'll just save lives.
Yep.
And if you can put your information in the chat, people are asking for it.
Yeah, I just put in my email, email, and I'll just put in that website. It's real easy.
Okay.
We try the website is not real complicated. When you want more in-depth clinical studies, we can provide it, because it was really designed for any patient to go there and start to feel comfortable. One of the challenges in our field is, as the technology develops, how do you educate your patient? If in fact the patient is a participation sport, then they got to know what they're doing. So it's kind of designed that way, really easy videos for them to understand, and they can go deep as they want. And so if you want more deep science, I can take you through more and quite often with patients, I'm asked, glaucoma, we're dealing with it. What do you suggest? And then we look at what I always try to find out what the doctor's currently doing and how do we augment that.
Right. Okay, so we had another question from Melvin. How does brain tap support IV therapies? To the best of what I've learned, Melvin, is they use isochronic tones, 9D sound, binaural beats, red and blue lights for the eyes, which penetrate the mitochondria. So it resets your parasympathetic and your sympathetic system and your autonomic regulatory system, your autonomic nervous system. In essence, it's forced meditation. A lot of people can't meditate. They can't. So this is all done for you. It's a $800 headset, and it's a couple $1,000s for the $3,000 to $4,000 for the heart rate variability monitor. And we can in 3 minutes print out colored processes and lab reports per se of your what do you call that? Your heart rate variability, your brain processes, nervous system, everything. It's pretty powerful. It's amazing. And if
That's
we
great.
need to connect, I'll talk to you personally. I'm here in Reno, Nevada with Dr.
So
Clearfield.
it's very safe, something that the patients can do on their own. And
Yes. And not only that, corporations, professional sports teams, college teams are now introducing brain tap teams into their corporations and their rooms for before and after their sports for recovery. It's pretty mind-blowing, I'll just be honest.
that's great. Yeah, for us, we have so many professional athletes using it, cyclists and
Right.
basketball coaches and that whole range. One thing that we're really excited about is that daily use for the patient, safety and constant, because the challenge for our field is it's all cash-based for the most part. So they need to have the results. And if you do something that's going to augment the results of whatever your therapy is, and that's kind of how we got so active in the stem cell and exosome world, that daily regeneration is really key, in that protection of the body from electrosmog. So that's been really big.
That's
And
huge.
so
That's huge. Another question, could the goggles be used with a high Gauss system? I can see lots of possibilities with treatment of cataracts. Yeah.
well, they
See
are
why not.
using it for cataracts now.
Right?
You can't really use the goggles with the high Gauss system. Again, this is resonance-based, so it's a little bit different. It's affecting the frequency, and it's just in the signal. So they're actually they're not high Gauss, but we have great results with cataracts. Although most of our clinical studies with glaucoma and macular degeneration, but we have seen great results with cataracts. And recently we had a result with a gal who had retinal dystrophy, and she was on her second or third scraping, and the ophthalmologist said, "That's it, my dear. We cannot scrape anymore, and you're just going to lose your sight. You're now at 80/20." She got on the goggles, and we were going to do an exosome treatment as well, but I said, let's try this. And after 4 weeks, she calls, she said, I'm at 60/20. 6 weeks, she said, I'm at 40/20. She was just elated. So we've seen huge results in the regeneration of the cells in the eye area. So yeah, so I don't know if any high Gauss system have goggles. I'm not really an expert in that area. Yeah. So that's I can share with you what we know and what we have from Germany.
Were you able to put your information and your email in the chat? I don't see it yet.
Oh, I did, but I'll put it in again.
Okay, thank you. All yours, Doc.
Who is not a good candidate for this, Dave?
Great. I love you, Doc. I love the question.
Well,
No,
we're trying to
that's-
build you up, but we want to stay out of trouble.
No, I agree. I agree completely. Okay. So we don't have research on epilepsy. And so you would use a very low setting on epilepsy if you have an epileptic patient. But as you know, there's different causes for that. And I have heard doctors getting success, but we specifically don't say if it's epileptic, you want to be reduced. If it's the big C word, we all know what the big C word is.
Right.
Great success, but with very low settings. You don't want to do high settings on that if they're dealing with C. And I'll just say, well, cancer. So great results, tremendous results, but with low settings. If you have high blood pressure, again, begin with low settings, but that's all in the documentation. So we really don't have a specific contraindication because it's so low Gauss. If you imagine the Earth is 50 Gauss, so and we're only at 40 Gauss or micro Gauss. So, I guess if anyone it's not good for them to be outside walking. If someone's very, very sensitive, electromagnetic sensitive because of where they've been living, and then what you do is you actually put the mat even 2-3 feet below, so they get a very slow, light stimulus. But then quite often, then they get stabilized and they're able to use it in a regular fashion, right under their sheet.
What about what we always ask about pregnancy? Do you have any information on that?
Well, again, we don't have specific studies on pregnancy, which is one of the challenges of pregnancy. But understanding the science, there appears to be nothing at all in it that would have a negative effect on pregnancy. It's really creating a stabilized field. Again, a little bit lower settings. If you're on the whole mat, but if you have an area of pain, let's say the knee or the ankle or the shoulder, you can definitely use a higher setting. But on the whole mat, which you're sleeping on every night, and in most cases for deep sleep, they use the lightest settings. So it should be no problem at all for pain. And I've used it for my daughter and my daughter-in-law. So I believe in it at that level.
Another question, Doc, from Melvin Nario. Is there a similarity with Rife to your machine?
That's a really good question too. I'm not an expert in Rife, but I have talked with some doctors on it and how it works. The challenge with Rife is and there's all kinds of Rife and Rife replacement technology, but the original Rife technology, you have to dial it in for specific frequencies, and it's quite complex to do it well, and you may miss it. The difference with our device is because it has a field that it runs through, it matches all the organs in the body, so no special settings are needed other than a little bit more or less Gauss, and then it has a relaxed, medium, and vital, which is really the sympathetic nervous system versus the parasympathetic. The relax is supporting the parasympathetic. basis is your normal, and then the vital would be high stimulus. So, and another contraindication or consideration, if someone has some severe heart issues, again, lower setting, you don't want to use the high, if they have a shoulder pain, but they have a very sensitive heart issue, don't use the high setting on the shoulder. It's not needed. You can do it slowly. But if you're down in the knees or the ankles, there's no problem at all.
What about a heart defibrillator or a pacemaker? Is that a contraindication?
No, not
Okay.
at all. All the studies you see on that will say anything lower than a Gauss is safe. And we're not even at a half a Gauss.
Thank you.
All right, I'm gonna be a bit of a wise guy now, Dave, and I don't know, I don't expect you to be able to answer this, but you know what I do, right? What
I
are the
love you,
effect-
man.
What is
Hit me with it.
what is the effect of your these frequencies on hormones?
Well,
I told
you're
you
the
I'd be a-
hormone expert. You're the hormone expert. So I can give you my guesstimate. I think you're going to get an improvement with hormones just because in the end, it's all what the cells are doing. You're
Right.
providing the hormones to help better cellular function. If
Mhm.
cells are healthier, whatever hormonal therapy or other therapy, you're going to get better results. And we've seen it. Because I'm not in the hormone world, I can't comment, but in certainly in the exosome and stem cell world, we see a huge improvement, and in the vitamin world. So there would be something, I'd love to test out.
You turn it around and say, you look at it, you find it, right?
No, well,
No,
I
you
just-
say
I
that to
just share
me.
with what I know. No, but
Say it.
I would guess it would be helpful. Let me, if you got a good patient, let's test it out and do a little study.
Well, we're gonna see one tomorrow that's pretty complicated. I got about 300 pages worth of records here, and so let's see if you got anything for us. This kid's about 20 years old.
Oh my
He's
goodness.
autistic. He's had about 6 head injuries. He's pretty non-functional. Apparently, he had some reactions to vaccines, the MMR vaccine, when he was about 3 or 4, and that sort of triggered it. He sort of came out of it, and then he went to college, and in college, his college roommates gave him some marijuana brownies, and he had a psychotic episode after that.
Oh.
And now he's sort of living in a residential community, and he hears voices and talks to the walls, and he's on a whole bunch of antipsychotic medications. And I gave a talk at an outfit called Frequency Specific Microcurrent, which is sort of like the Rice people, and I guess his mother was in the audience, so I'm supposed to interview him tomorrow online. And there's a whole bunch of records here, mostly from psychiatrists. And what do you have? What would you have?
Well, you did mention he's on somehow the spectrum, and now you got, I call it spiritually open, whatever. But what we found with autistic patients, they do very well because they get this deep, relaxed sleep, and it really helps them at night, and they're not really being bombarded. So that's been very helpful, and it does improve their digestion. So with autistic patients, it's been very helpful. So, with, you've got the 300 pages of notes. I don't.
Yeah.
But yeah, I'd love to talk to you about it.
So the question for you is that with just that limited information, is there anything in your world that might be of a help?
Well, I would say that fermented ginseng can be very helpful for sure, because it's balancing the autonomic nervous system. The challenge depends on how he can take it. If you can, swallow it, it's fine. The combination with the mat is very good. I wouldn't, necessarily think about, exosomes or stem cells at this point, but
Right.
The mat would be very good. Deep sleep is such a huge impact on restoring fundamental health. And when
Mhm.
there's a lot of mental activity, they can't get that good sleep. And if he's on a lot of psychotropic limiting medicines, it's an extra challenge.
Right. Okay, there's another, I hope we get the email for David and his website. I'm not sure.
Oh, you know
Put that
what?
in there or no?
It still hasn't come through. And then Dr. Gerber
Okay,
has a question. Also, he has his hand raised. And so does Shell. Shell mentioned about
I just sent it again, everyone. Oh, you know what? This went to, it didn't go to everyone. That's the problem. Sorry.
oh
Okay,
yeah,
let me-
we're not getting it. Shell had asked a question.
here it is. It didn't go to everyone. Okay, I'm gonna send it again, but go ahead, Shel.
Okay, Shell asked, are you familiar with ionic cyclotronic resonance from A.R. Leiboff? Sequex.ca, sequex.it, question mark, 30 wave forms. It's kind of like a little
Actually,
bit of.
I'm not. I
Okay,
can't comment on that one.
that's the Bob Connolly, I believe, and A.R. Leiboff out of Italy.
You know, maybe our Italian people might know more of it, because there's a lot of the devices in Italy.
Agreed, agreed. Dr. Gerber, if you want to come off mute and ask your question.
Am I off now? Do you hear me now?
You are, we have your voice, Michael. It's
I
glorious.
haven't. That only took me about 12 hours.
Took 2 weeks to get to it, but we're here.
Yeah. Well, actually, this is a remark mostly geared to last week's Zoom lecture on CBD THC. And we were just talking about a poor guy that went to college and got overdosed on, sounds like THC, had a psychotic reaction, bumped back into his autistic state. So I was in Florida 3-4 years ago at a Best Answer for Cancer conference. And there was a PhD, actually, he worked for the drug industry for a while, but he does all of the testing for the state, or the lab testing for the state of Colorado and THC CBD products. And it came up but that limonene, which is one of the products in THC CBD, will antidote toxic effects of CBD THC. And you know, a lot of times when people go to a Christmas party or a Thanksgiving party, and somebody brings a THC laden pie or something, and you've got this person that's you know, pretty much not breathing and pretty well out of it, and you know, beating on her chest. And I've had the opportunity to do that. But if you just take the rind of lemon and squeeze it into some hot tea water, and have it, get it down the patient's throat, they'll come back in about 5 minutes. I've had a couple of opportunities to do that. It will immediately reverse THC CBD overdose. It's limonene. And just in the general you know, topic about, you know, starts, you know, starts low, goes slow is, you know, a great idea. But if somebody ODs on it, you can pull them right out with the lemon rind squeezed into hot tea water.
You know, and just to add to that, Dr. Gerber, it wasn't just a THC overdose. Because of the overdose, when he was administered into the psychiatric ward, they vaccinated him with the pneumococcal and the flu vaccine. And the parents believe that activated his Lyme's and his Bartonella. And that's where they believe that the autism came back. So it's just, it's a sad setup.
Nothing like a little bit of finely ground aluminum for your neurological status.
Agree.
Right.
Very good show. Very good show, Dr. Konn.
Hoorah.
Yeah, thank you. You know, I did finally get into the everyone. So if you want to call me anytime, you know, whatever, any way I can help and serve any of your clinics, I'd be honored.
Hoorah.
Yeah, we'll try and get some contacts for you, Dave. Okay, either tonight or tomorrow. Okay, from the group here. So, anybody else have any comments or questions? Or so somebody calls and says, I got somebody that I think is might benefit from your PEMF mat. Is there a workup that needs to be done ahead of time? Is there
No, it's kind of simple. I'm only basically doing with doctors, but basically they can't find somewhere else, cheaper or anything like that. It's $46.50, and if the doctor wants to be involved in more than just giving the name to me and we handle everything.
Mhm.
Even in that case, I always call the doctor to know what kind of protocol they're on, what the patient's situation is, so we're in complete harmony with the doctor. But we send them a commission of 20%,
All
and
right.
we do everything.
Yeah, I
But
really
after,
wasn't. I wasn't really
I'm sorry?
asking about. I wasn't really asking about money. I was asking more. More like, who's a good candidate for this? Who is not? Everybody's a good candidate for it.
why, that's anyone with pain, obviously, that's the natural one, it reduces inflammation very rapidly. Anyone who has overall issues in having sleep challenges, we have several MS patients that transformational, their sleep improved and everything locks in. I would say those are basically an autoimmune challenge you're working with. Again, it's going to promote the sleep, it's going to promote the cell stabilization as you're trying to reduce them from being all over the place. Even if there's a mold issue, it can be helpful.
Mhm.
Um,
How long is
I'm
the
just trying to
session?
think. I'm sorry?
How long would a session be?
Well, this is a good question. In the clinic, we do have some clinics who mainly focus on it, and it'll do 16, 24 minutes. In Germany, they do 16 or 24 minutes. You can do it for an hour. If the patient has a lot of pain, we've had great experience that they do the whole mat for 8 minutes, and then you put them on the pillow on the area of pain for 50 minutes. And we've seen huge results, even in one treatment, where they
And
walk out and they're,
how often would you do this, let's say, in a chronic pain patient?
well, I would say as much as they can come in. You could do 3 times a week, you could do once a week.
Mhm.
It would be, and then the
What
nice thing
would-
about it is it doesn't require any clinician, any staff to manage. They just basically set it up, 2-3 minutes, and they're there.
That
So
was the
there's
question I had. Do you have to be licensed or non-licensed? Can a regular staff person use this?
no license is needed.
Okay.
Now, again, as I showed you in the clinical studies, if you're saying you're treating a certain condition, you want to be very, careful what you're doing, but no, it's very safe. Even at home, patients, they do they do everything themselves. And the only here's a contraindication. Sometimes they get such benefit. We had some neuropathy patients who do very well. And we had one doctor in particular, he said it was so great, nothing had worked. And he was just exuberant. So he decided to put it the highest setting all day long. Well, what happened was it stopped working. And we couldn't understand what was going on until we questioned what's going on. He said, well, yeah, at Vital Intensive, I use it 60 minutes, one after another all day. Well, what's happening is you're really overstimulating the cells and you're really supporting the cell's own regeneration. No damage, but it doesn't continue working. So you want to back off. You really don't need to do more than, they say, an hour and a half in a day. If you're looking to do it at nighttime for the sleeping, if you get up, here's an important point. If you're promoting deep sleep, when they get up to go to the restroom, they want to turn it on again. The reason is it does turn off the maximum setting 60 minutes, but it retains the field. I had a big question with the engineers. What do you mean it retains the field? How do you do that? They said this is so resonant to the body. The body is like a battery. The field is set and it maintains itself from the body's own energy. So, but once you get up to go to the bathroom, you now break the field. You got to turn it on again to reset the field. So that would be something where people have a little insomnia, or they get up, or they're a little bit older than 35, and they sometimes have to urinate more than once a night.
Do they glow in the dark?
They do not glow in the dark. That's one thing I can't offer.
Okay. Okay, got anything else? Okay, we got David, we got your phone number, we got your email and your website.
Yeah, it's there.
And anybody wants to have any questions, we can we'll put you on our list. We usually keep our speakers for a few weeks, we'll put the video on and have you be able to get in contact with anybody who might be interested. Okay.
Yeah, I apologize for the clipping and the video wasn't on. I mean, the PowerPoint wasn't on the
Oh,
beginning.
don't worry about it. 2 weeks ago, I didn't turn the recording on at all. So it turns on as soon as I turn on Zoom, and I turn it off because there's nobody on until we start, and I forgot to turn it on. So I missed the whole lecture. So
Okay, great. Yeah,
Okay.
email me or
so
call me.
Dr.
I'm
Stein's
happy to help.
Putting on some links for some articles, which I'm not sure what they are. I can't do it because I'm the host here. So Shell, what are they?
Well, this is research by Dr. Alessandro Greco on the Onyx cyclophrenic resonance or sequence device from
Mhm.
Trento, Italy, and he works out of a nursing home. So he does things that are pretty innovative. And I've had the opportunity to learn a little bit about the machine. There's so much to learn, and I think this is a new frontier. So I believe just it's good to share things. And then Dr. Leboff, who recently passed away in January of this year, there's a lot of articles about what he writes about in Google Scholar. And he has 30 waveforms and a lot of different programs. And I just think it's a fascinating area. It's a new frontier, and it's good to share information with everyone and learn from each other.
Yeah. Well, I know Dave's been at it a long time, and he's our resident expert in all of the PM.
Yeah, I'd love to
anybody
learn
has
from
any
him.
questions about it, he's the guy to go to. So, and John's not here tonight, so I can't pick on him. Anybody else have any comments or questions? Thank you all, Ben. If not, we'll let you go home early. We're not Dr. Halassa, where we'll talk for 3 hours. Okay, I guess A4M is this weekend. I don't know if anybody's going there. I won't be there. But if anybody is there, please.
Is that in Hollywood?
It's in Orlando.
Orlando.
Yeah. So Stefan Hartman, who's not here tonight, and I did a little banter on our AMMG meeting for 2 weeks ago, and he unbeknownst to me, he actually videotaped it. So we're going to put that up on the website. That should be at the end of the next day or two. It should be up there, and it was pretty funny actually. He's kind of asking me questions and whatnot, and I didn't really know he was recording me, so I was kind of natural, I guess. So I might have said a few things I shouldn't have, but so if anybody wants to get a flavor of what that group is like, they're a nice group. You've been there a few times, Dave.
Yeah,
they're really
nice.
They're a good group, and we're trying to lean on them to join us here so we can sort of expand our reach. Again, we'll ask everybody, bring one friend, and we will double our census. So next week we have Dr. John Casey, and I forgot to write down what he was talking about. So it'll be in the email. The week after that, by the way, Dave, we have Carol McMakin. You know her, she's from the frequency specific microcurrent group. So it's a little bit similar to you. She's going to be talking about Ehlers-Danlos syndrome. So so that's hyper elasticity, and it's a genetic defect. So so that's coming up in the next couple of weeks. And after that, We got Jay Campbell next month. He's peptide guy. I met him at AMMG, and he's a bit of a character, but he's going to be sort of giving us like a sort of intro to, you know, high-powered intro to peptides. He's pretty knowledgeable on that, so we'll be looking forward to that. Anybody have any comments, questions? Thanks, Dave, for always being there for us. You know, we will call again and let me know where you guys are going. By the way, I've had a few inquiries about doing some hands-on stuff. So I have a couple doctors coming to Reno. It's going to be July 8th and 9th. I know it's kind of a short notice, but if you want to learn how to do or hormone pellet insertion, battlefield acupuncture, the auricular acupuncture, we'll do some practical beginners bioidentical hormone, some PRP we're going to do, and we're going to do it at my office unless it gets too unwieldy. So if anybody's interested in that, let me know, and we'll find a place for you to stay. There's some pretty nice hotels here, and not too far from my office, and we'll make 2 good days of it. And in July, it is a little bit hot in Reno, but July's pretty fun here. There's Art Town, so there's music and workshops, and every day of the month from July 1st to July 31st. It's the best time of the year in Reno. So if anybody's interested, let me know. We're going to keep the cost to a minimum. You know, we haven't gotten together you know, in over a year, at least in person. And it's time to start breaking out. So we're going to start small, start low and go slow. If anybody's interested, let me know. Other than that, we'll say good night. Remember again, sorry, just so and this video, if it's okay with you, Dave, aosrd.org/webinars. All of our
Okay, great.
videos, except for the one 2 weeks ago where I forgot to turn the video on, are on there. There's a wealth of information there. We have over 2.5 years worth of lectures. And it's really, you know, we really have some really great speakers and, you know, a lot of good information. With the AI things now, I think we're gonna sort of go revisit them and get some summaries together. So it'll make it a lot easier for us to sort of organize things a little bit better. So
Can I add one more thing, Doc?
go ahead.
We have a lot of great restaurants, old restaurants that I've been learning about lately. And we also have a little brewery district that's pretty powerful downtown. And then we have a midtown downtown, and they're building up this downtown with a light district and a really artsy feel. It's something like you've never seen. It's pretty powerful. Would love to see you all here.
So, yeah. So anybody's interested, let us know. And if you're not, be your loss. So that's okay, everybody. Anybody else have any comments or questions? Thank you all. So a couple of names I don't recognize. Thank you for coming. Regulars, of course, thank you for coming. Anybody have anything they'd like to present, please let me know. And we'll be here again next week, same time, same station. And with that, Dave, again, much thanks. Over and out, I guess. Okay.
Right.
Yes, no? Okay. Good night, Dave. Thanks. Thank you.
Good night.
again.
Thank you.